Welcome back. In this video, we'll talk about the lymph node zones of the neck. You have to memorize these zones by number and name because different pathologies and different medical treatment and surgical involve specific names and specific zones. Zone 1 is the submental and submandibular area.
Zone 2 upper jugular area. Zone 3 middle jugular area. Zone 4 lower jugular area.
Zone 5 is the posterior triangle. And Zone 6 is the central area. Sometimes they add Zone 7, which is outside the neck, and that is the anterior or superior mediastinal area. Zone 6, or the central area, is very important, and the lymph nodes we see here are the anterior jugular, the pretracheal, the paratracheal, the precricoid, which is also known as the delphin nodes, and the perithyroidal nodes. If they ever ask you about the zones of the neck, they will likely ask you about one of these lymph nodes. It's also worth talking about lymph node dissection, which is a very important topic for cancer and metastasis. Radical lymph node dissection involves removing all lymph nodes of all of these areas, plus many structures of the neck. Modified radical lymph node dissection involves removing all of these lymph nodes without one of these structures, the accessory nerve, the anterior jugular vein, or the sternocleidomastoid muscle. Central selective lymph node dissection is very important for thyroidectomy, where we remove the central lymph nodes of the neck. Lateral selective lymph node dissection is performed when the central lymph nodes are very highly diseased, for example, in very advanced thyroid cancer. In this case, we remove the central and all of the jugular lymph nodes. And finally, posterior lateral selective lymph node dissection involves removing all of the lymph nodes of all of zones in the neck except zone 1. And that's all about the lymph node zones. Thank you guys so much for watching, and hopefully this helped.